Hey, what is the LCL? This is Dr. P. Got a problem with your knee? Ask Dr. P. And somebody asked me, what is the LCL? LCL stands for Lateral Collateral Ligament. Ligaments connect bone to bone. So this is a knee, and you have your thigh bone, your femur, your shin bone, your tibia, your fibula, which is the outer leg bone. In this case, it does come into play here. And then you have your patella, your kneecap. Ligaments connect bone to bone, so the most common ligament sprained around the knee is the MCL, along the inner side of the knee. If this is a right knee, the inner side of the knee. The outer side over here, the LCL, lateral collateral ligament, and then you have your ACL in the center of the knee. This person's is torn, and then you have your PCL in the back of the knee. So the LCL is the lateral collateral ligaments on the outer side of the knee. Now, interestingly, if you look at the MCL, which is more, this one's torn as well, but it's more like it's wider and it's kind of fan-shaped, whereas the LCL is more rope-like. So when this thing tears, and it tears in two, or it tears off the thigh bone, or tears off here, it's a lot less likely to heal because it's not in space. There's other soft tissue around it, but not like as much soft tissue and as much surface area to heal as the MCL. And the MCL, when it tears, it kind of stays in place, and even if there's a gap, it'll usually fill in and heal on its own. The LCL, if it's torn in two, it's kind of like when a rope tears and the ends are kind of frayed, and it's hard to get that to heal back together. Also, that'll kind of tend to plastically stretch out a little bit more than the MCL will. And so how do we diagnose it? Well, we diagnose it by history. Usually you get hit more on the inner side of the knee, and the leg kind of goes like that, as opposed to the MCL getting hit on the outer side and the leg goes like this. The physical exam, when we examine, if it feels loose, there's ways to examine for it, but also MRIs are good. And so on this MRI right here, here's the thigh bone, the femur, which is kind of blackish here. Here's the shin bone, which is the tibia. Then here's the fibula, this bone right here. And you see this black rope-like structure coming down. It basically looks just like that ligament that you see on the model. This is the LCL. Now, it should be completely black, and all this white stuff you see around it, anything that's white is fluid. Like these are little veins over here, and there's some fluid within your joint normally to lubricate it, but there's normally not this much swelling and fluid along the outer side, the lateral side of the knee. So even this muscle got injured here a little bit, but this ligament is stretched out, especially where it attaches to the thigh bone here, the femur, and it's grayish whitish. Now, it's not a complete tear, so that would be a grade 3. It's more of a grade 2. It's stretched out. It's definitely not a grade 1, because a grade 1 wouldn't have this much other associated injury or this much signal. So this would be a grade 2 LCL sprain, and that would usually not need surgery. This person did not need surgery. But this is completely torn, yes. Sometimes the only way to get that to heal is go in there and sew it back together. One like this would be very amenable to putting PRP, platelet-rich plasma, or bone marrow aspirate cells pretty easily. We can see this real easy with an ultrasound as well, and inject to get this area to heal faster and stronger. At least that's what we think. But either way, that is not going to usually need surgery, but it might need a brace to kind of keep it stable while it's healing. So that's what an LCL injury is. It's a lot less common than an MCL injury.